Today we are going to discuss some of the most common medical coding interview questions and how to answer them confidently. Medical coding interviews mainly test three things: your understanding of coding fundamentals, your attention to detail, and your knowledge of coding guidelines and compliance. Let's go through the most frequently asked questions one by one. Question 1. What is medical coding? Medical coding is the process of converting medical diagnoses, procedures, and healthcare services into standardized alphanumeric codes. These codes are used for billing, insurance claims, medical records, and healthcare data analysis. Accurate medical coding ensures proper reimbursement, correct documentation, and compliance with healthcare regulations.
Question 2. What are the main coding systems used in medical coding? There are three major coding systems.
ICD-10-CM is used to code diagnoses and medical conditions.
CPT is used to code medical procedures and services performed by healthcare providers.
HCPCS Level 2 codes are used for supplies, durable medical equipment, and non-physician services. Each coding system has a specific purpose and must be used correctly. Question 3. What is the difference between ICD-10-CM and CPT codes? ICD-10-CM codes describe what condition or disease the patient has, while CPT codes describe what procedure or service was performed. In simple terms, ICD-10 answers the question why and CPT answers the question what was done. Question 4. What is upcoding? Upcoding occurs when a coder assigns a higher level code than what is supported by the medical documentation. This is done to receive higher reimbursement and is considered fraudulent. Upcoding can lead to audits, claim denials, penalties, and legal action. Ethical coding practices are extremely important in medical coding. Question 5. How do you ensure accuracy in medical coding? Accuracy in medical coding is ensured by carefully reviewing physician documentation, following official coding guidelines, referring to coding manuals, and coding only what is clearly documented. Coders should never assume information and should double-check codes before submission. Question 6. What is medical necessity? Medical necessity means that a healthcare service or procedure is reasonable and necessary for diagnosing or treating a patient's condition.
Insurance companies only pay for services that meet medical necessity criteria.
If a service is not medically necessary, the claim may be denied even if it is coded correctly.
Question 7. What is the difference between a principal diagnosis and a secondary diagnosis?
The principal diagnosis is the main condition responsible for the patient's visit or hospital admission.
Secondary diagnoses are additional conditions that coexist or develop during the encounter and affect patient care, treatment, or length of stay.
Proper sequencing of diagnoses is essential for accurate billing.
Question 8. How do you stay updated with coding changes? Medical coding guidelines are updated regularly. To stay updated, coders should review official annual updates, attend training sessions or webinars, follow coding newsletters, and participate in professional coding forums. Continuous learning is essential in this field.
Question 9. What should you do if the medical documentation is unclear? If documentation is unclear, a coder should never guess.
The correct approach is to query the healthcare provider for clarification according to organizational policies. This ensures accuracy and compliance with coding standards.
Question 10. Why should we hire you as a medical coder? A strong answer should highlight attention to detail, knowledge of coding guidelines, commitment to accuracy and compliance, and willingness to learn. Employers look for coders who are reliable, ethical, and consistent.
Question 11. What is the role of modifiers in medical coding?
Modifiers are two-character codes added to CPT or HCPCS codes to provide additional information about a procedure or service. They explain that a service was altered without changing its basic definition. Modifiers help communicate circumstances such as multiple procedures, reduced services, or services performed on a specific side of the body. Correct use of modifiers is important to avoid claim denials and ensure accurate reimbursement.
Question 12. What is the importance of compliance in medical coding?
Compliance in medical coding ensures that all coding practices follow official guidelines, payer policies, and healthcare regulations. It helps prevent fraud, abuse, claim rejections, audits, and legal penalties.
A compliant medical coder protects both the healthcare organization and the patient by maintaining accuracy, transparency, and ethical standards in documentation and billing.